Hey everyone, let's jump right in. This is a sneak peek into how we at Exam Coaches break down skin treatment strategies so you can crush it on the NCLEX. We're going to talk about how to stop just memorizing stuff and start actually prioritizing like a pro. You know, when it comes to integumentary questions on the NCLEX, it's not really a knowledge quiz. It's a game of clinical judgment. It's less about what you know and way more about how you think.
And this is the absolute core of it. The exam wants to see if you can pick out the single most critical action to take, not if you can list off a dozen different creams. It's all about the why and the when.
And believe me, the stakes are super high. If you miss one little assessment finding, one subtle sign that things are going sideways, you're not just losing points, you're missing the entire point of safe nursing practice.
This right here, this is the mindset you've got to have. Ask yourself, is this action about saving a life, preventing shock, stopping an infection, or is it about how something looks? The NCLEX will always reward the choice that puts patient safety above everything else. Period.
So why does this topic trip so many people up? Honestly, it's because it's so easy to fall into what I call the memorization trap. Let's talk about what that looks like.
Okay, be honest. Does any of this sound familiar? You've got allergic reactions, you've got chronic conditions like psoriasis, and then you have major trauma like burns. It is so easy to get lost in the weeds just trying to memorize products, but totally missing the big picture, which is, what's the first and most important thing I need to do for this patient right now?
And that's the million-dollar question, isn't it? It's all about having a system, a mental framework that helps you organize all this information, especially when you're under pressure.
And that is exactly what we build at Exam Coaches. So let me give you a little preview of our prioritization framework for integumentary management. All right, check this out. We don't see a random list of skin problems. We see categories: allergic, inflammatory, and traumatic. And each of these categories has its own set of rules, its own priorities, and its own red flags. Let's see how it works.
Let's start with a really simple comparison. For poison ivy, an allergic reaction, your immediate goal is symptom relief. Think calamine lotion, soothing the itch. But for sun damage, the priority is completely different. It's all about prevention, teaching the patient to use sunscreen before they ever go outside. Two totally different goals, two different nursing mindsets.
So, inside our platform, we're constantly training you to ask those next-level questions. Is this a local problem we can fix with a cream? Or is this thing escalating systemically? Is the patient scratching so much they're about to get a nasty secondary infection? These are the kinds of questions the NCLEX is built on.
Think about that for a minute. What is your first move? Is it grabbing medication? Is it doing a deeper assessment? Is it education? Your answer here really shows your ability to prioritize on the fly.
Okay, now let's level up and look at inflammatory conditions. With something like psoriasis, you're playing the long game. It's all about managing a chronic condition and its flare-ups. But with something like severe acne, the intervention might be much more acute, more urgent, to prevent permanent scarring.
And the key word here is definitely monitoring. Those systemic treatments for psoriasis can have some really serious side effects. You have to be able to recognize a red flag alert, like when your patient's skin complaint is suddenly joined by joint pain, which could be a huge sign of psoriatic arthritis.
And here we go again. The NCLEX absolutely loves these kinds of questions. They're testing to see if you can connect the dots between a skin condition and a potentially serious systemic complication. What do you do first?
Now, for the heavy hitter, trauma. With burns, that initial assessment of the burn's depth and size is obviously critical, but that's immediately followed by a huge, massive shift in priority over to the systemic response. This is where lives are saved or lost.
So what's the bottom line? ABCs always come first, no exceptions. After that, your next big fights are preventing hypovolemic shock with massive fluid replacement and stopping sepsis with perfect sterile technique. The skin is the injury, but the systemic crisis is the priority.
This is such a classic NCLEX-style question. The pain is bad, you can see the blisters, but is that the most immediate life threat? What's the core principle that's going to guide your very first action?
Okay, so we've glanced at allergic, inflammatory, and traumatic conditions. On the surface, they all seem so different, but inside the Exam Coaches framework, they are all connected by one simple, powerful, unifying principle. This is it. This is the secret sauce. For any integumentary question you face, you run this play. First, assess the severity. Is this a local issue or a systemic crisis? Second, prioritize safety. What's the one action that ensures the patient is safe right now? airway, shock. And finally, implement monitoring. Look for infection, watch for side effects. This is your key to everything.
Because at the end of the day, preparing for this exam isn't about cramming facts. It's about building the solid clinical judgment of a safe, effective nurse.
We don't just hand you a list of treatments. We train you to recognize a complication before it spirals out of control. We drill you on choosing the #1 priority intervention every single time. We are laser-focused on building your clinical judgment so that on exam day, it's just second nature.
Please remember this. It's not about picking the most complicated or fancy intervention. It's about picking the safest and most timely action for that specific moment in time. That's how you score high, and more importantly, that is how you become a fantastic nurse. So, this was just a quick look at our method, the entire in-depth framework with all the nursing interventions, and yes, the answers to those questions we asked is all waiting for you inside Exam Coaches. It's time to stop memorizing and start mastering your clinical judgment. Thanks for watching.